Today, we're going to talk about cross-cultural solidarity in times of COVID-19. And we have with us 4 people from different communities who could have extensive experiences and perspectives on the issue of COVID-19, healthcare, public health, systemic inequalities, and among other things, we call it health equity. So without any further delay, I would like to start first with Tiffany Callender. Good evening, Tiffany.
Hi. Oh, nice to be here. Thank you for having me.
Okay. You're the executive director of the Côte-de-Neiges Black Community Association, which is sort of well known for its service to the community, not only in Côte-de-Neiges, but beyond. Can you tell a bit more about your organization, what it does, and what kind of services it provides?
The Côte-de-Neiges Black Community Association is a nonprofit org that serves the English-speaking Black community primarily, as it is a visible and language minority community here in Montreal and in Quebec. And that's where it found its roots, serving a lot of families from the English-speaking Caribbean, but of course open to the diversity of Côte-de-Neiges, Côte-de-Neiges being one of the most diverse boroughs in Montreal. And we work in social development and in culture and recreation and leisure. So with different partnerships from the City of Montreal to the federal government, we have a very broad demographic body, meaning that we serve from children ages 3 up until seniors well into their golden years. So during the pandemic, a lot of our social development programming came to the forefront because it's been at the core of our ability to serve during this difficult time. But the Côte-de-Neiges BCA is 49 years old, so it is one of the longest running organizations in Montreal and even in Canada. I recently found out. Mm-hmm. So and it's been a very important institution to continue to serve those from the Black community that are long-standing communities, and also now receiving immigrant communities who are coming into Quebec, who their first or second language is English.
Like any other organization and like any other community, the Black community in Montreal has been hit by COVID-19 at the different levels, and it hit quite hard because of so many factors. So can you speak about the impact of COVID-19 on the community and the people who are served by your association?
Yes, absolutely. What we knew when we realized that the pandemic was going to be really a long-term crippling situation in terms of the people that we serve, we were able to very quickly make a hypothesis around the impact, because the community that we serve are often single mothers living at or below the poverty line with 2 to 3 children. We serve seniors who are pensioners who often live alone. And we understood at that time that meant that the pandemic was going to exacerbate a lot of the socioeconomic challenges that these families and individuals face. And we were able very quickly to react to what we knew would be problematic. What do we know was going to be problematic? Having access to information in English to be able to understand where they could have access to resources, being able to go out and get the necessary items that you need during a confinement. We have mothers who have newborn children or little children. So now making the decision to have to use public transportation to commute, to get to grocery stores and bring their children with them because they might not have childcare or have somebody who can assist them, it exposes them to the virus. For those who are in the workforce, that work in hospitals or work in frontline services, they were also exposed. We also understood that we have a factor of intergenerational living, where we have sometimes grandparents who live with the family, and now in a dynamic where people who are working frontline are coming home, you're putting at risk members of your home. And last, we also knew with children, when we saw there was a hard stop in terms of school last year, we worried about, do these families have the devices that they need to be able to follow online school? Do they have high-speed internet? These were things that we automatically, we were able to deduce that these were going to be challenges. And very quickly, we started to try to find solutions to alleviate some of those problems. and ensure that we could continue to support in accessing what they need or getting it to them. So that was the big, I guess you could say, the epithet of our emergency services. It was based off of the existing conditions and existing realities of those families and individuals.
Yeah, you mentioned something that is very, very important to this, the Black community, particularly in Côte-des-Neiges. Côte-des-Neiges has many healthcare institutions. And as you know, particularly in English-speaking healthcare institutions, we see a lot of Black, Asian, South Asians, and Arab workers as working as healthcare support, and nurses and doctors. Then, of course, that's a very vulnerable population. And believe it also, I think the data show that COVID-19 affects women usually more than men. And one reason why, because there were more women working in healthcare.
Correct.
So can you tell us about some of the, you come up with any particularly safety issues about for Black women, and particularly Black women working in healthcare?
Well, it wasn't even just Black women, because like I mentioned, we work in Côte-des-Neiges. We also have a lot of Filipino families that are part of the organization. Their children go to the day camps. And we also have a Filipino Strengthening Families program, which is a program that we've run for the last 13 years with the support of the federal government. And recently we've started culturally adapting or assisting the Filipino community to adapt that program, which exposed us to also a lot of women from the Filipino community. And what we saw, exactly as we mentioned, within the healthcare services, there are a tremendous amount of Black women and Filipino women who work frontline in these situations. And the challenge that we saw was because the need was there, where they were constantly having to be on shift and coming home and being tired and maybe not always being able to take the necessary breaks. We saw the impacts socially, like at home. One of the things that we realized with day camps, for example, when we weren't sure if there were going to be day camps available, those women had to go to work. They had to be present, and there was not care available for them. We were concerned about mental health. We were, coming off of exhaustion and also being very concerned about their health and what they were bringing home by being a part of those industries. A lot of women also spoke to me about feeling so exhausted that they were unable to kind of nurture and care their children through this time, which is very difficult, not being able to see friends, not being able to go outside, and worrying also about when their teens would go outside, if they would get tickets from the police in terms of, so there was a lot of stress, a lot of anxiety that manifested during the pandemic. And then on top of that, being a frontline worker and being confronted with the virus and those trying to help those people who were suffering from it. I think it was a tremendous load on women of color.
So these are specific systemic conditions that affect women of color, women working in healthcare, single mother households and single parent households, and of course their children as well. So what do you think are some of the key, if we were to boil it down to a few systemic conditions affecting the community as a whole, and particularly the communities of color in times of the pandemic? What would you say these conditions be?
Yeah. Well, when we watching the COVID-19 intersect with the existing systemic discrimination and the barriers that people face, one of the things that I realized, especially during our project that we started, where we decided to collect race-based data when the government decided that they would not, so we could have an understanding of what is going on with our clients and document it, and at one point hopefully be able to reflect it back so that we have more tailored responses to deal with the pandemic. We realized that housing is one. So the housing conditions in which people live, if you live in a multiplex and it's not being sanitized or cleaned, this automatically exposes you more to the virus. We understood employment. So the fact that most of these women, the women that are part of our client base, are frontline workers, and we ask ourselves, well, is the reason because they do not have the education or the competencies to be able to work in different types of jobs? If they had access to different types of employment, then maybe they would be afforded the opportunity to work remotely. So again, because of the systemic barriers around the type of employment in which our community has access to, or denied. That obviously in the pandemic, we were able to see that. We also understood that with the fear that mothers and parents had about their children being over-policed and being stopped for going outside. The pandemic has been difficult on everybody, but for youth particularly. And we're seeing now that there are reports and articles coming out about depression and them feeling very isolated. Parents making the choice to send their children out to, go get some air, go play, go shoot the basketball. But if you're fearful that your child will be stopped by the police and given, a $1,500 ticket when you might be on CERB, these are the ways that we saw systemic discrimination and racism play out in the pandemic. And it kind of shone a light on some of the existing conditions that need to change.
Mm-hmm. So we're here basically systemic barriers based on race, based on gender, based on socioeconomic status, based on even civil status, single parent household, based on even the kind of work that people do and the concentration of people on this kind of thing. I think that many of the data have shown that the Black communities in Canada and in Montreal and the Indigenous communities experience a very special, difficult conditions in terms of the pandemic. So this gives us an opportunity to invite Professor Richardson also to jump in and also to continue this discussion about the impact of COVID-19 on the Indigenous communities here. First of all, welcome, Professor Richardson. Could you tell us a little bit more first about your program at Concordia, or what you do, what the program does, and how it serves the Indigenous communities here of the city?
Well, thank you. First of all, I'm delighted to be here, and I want to acknowledge my esteemed co-guests on your panel. And I just want to acknowledge the land. So I'm on Abenaki territory here, but in Montreal, we call it Jojage, which is the Mohawk name for Montreal, and the land of the Ganiangaha. And so we try to raise awareness in our classes about Indigenous people and situations and cultures and life. So our program is an undergraduate program at Concordia University in the School of Community and Public Affairs. It's for Indigenous and non-Indigenous students. Anyone can come. And more our focus is not only looking at Indigenous topics and developing critical thinking around colonization and government systems, etc., but also to move more and more into teaching with Indigenous ways and pedagogy, like sitting in a circle and bringing in older ways of teaching that brought community together in a different way. So we teach lots of different kinds of courses. And part of what we do is to do outreach with communities. So myself, I have relationships with the Native Women's Shelter of Montreal and Native Montreal. And colleagues and I, we have programs in Ganawage, getting more and more urban students out to the land in the community so they can learn survival skills and how to cook berries and make medicines and talk to elders. So part of our goal is to continue reaching out and sharing the knowledge and raising awareness about the Indigenous peoples around here and all over Quebec. So in terms of the pandemic, I just like to add to a lot of the things that Tiffany was saying, because that applies to urban communities quite a lot. And then if we look more to the north, in some of the more isolated communities, we're going to see some qualities that are unique and different. People are not necessarily in the city. So one of the challenges relates to sovereignty and Indigenous nations and having control over who goes in and who goes out. Because you probably saw in the news that some of the communities were setting up little border crossings and telling certain people they couldn't come in, like they had to have a good reason or permission. And because of this extractivist industries related to, mining and different sort of large scale projects, they go into communities to do their work. And so they send workers in, they don't always have the blessing of the community. Sometimes they have agreements, and sometimes it's been imposed on them. So when they have workers coming in from the outside, if only one worker has COVID, it's spread all around the mine and then into the community, and then you get a health crisis. And in these smaller communities, unfortunately, we don't have the services like we do in Côte de Neige, like there are a lot of hospitals and different services. And in the north, that just doesn't exist. And where it does exist, it tends to be run by Quebec and by mainstream social services, which are French. And so Indigenous people speak of a lot of racism. And I'm not going to go into that, but you just have to think of, the dear Joyce, as you can, in her experience at a Quebec hospital, and multiply that many times. Fortunately, not everyone ends up losing their life, but people suffer because they don't always get the care that they deserve as human beings, but also they don't get care in their own culture. So those are some of the issues. And I could just add a few, I suppose. When there's economic injustice, then it's hard for people to get the health services they need. But even at a more basic level, many communities still don't have clean drinking water that comes out of the tap. And the price of shipping food up there is really high. If a family's isolated, they might not have anyone who can care for them if they're sick. Or on the other hand, they might be overcrowded. Sometimes you get 12 people living in a little house. And again, if one person gets COVID, it just goes right through the community. So the economic disparities mean that the communities are more at risk. And if you look at things like, emphysema, asthma, diabetes, those kinds of health-related conditions, those are the people that tend to get hit hardest, right? So really, we have to look at social equality and inequality and see how people suffer who are on the lower economic scale, or who have been marginalized or colonized over time. There's these ongoing issues. I guess that makes sense for other communities too. It just builds on the existing inequalities and makes certain people suffer more. So I'm hoping one of the projects I have at Concordia, it's called Indigenous Healing Knowledges. And we're interviewing and talking to elders from different communities in Canada, but also places like the Maori in New Zealand, Aotearoa, and Greenland, the Inuit, to talk about how do you help people heal and be well using these older ways, and trying to bring that knowledge here to help people in this land.
Well, that's a very, very wonderful initiative. And I think maybe it's something that many other communities can also learn from. And because I think a lot of people also share many of the hardship, particularly the stress and the mental health issues. And you mentioned, I think some studies recently have shown that COVID-19 does create worsening the mental health conditions for many population groups, particularly for Indigenous women and girls. I think that Tiffany also talked about that as well in dealing with Black and other communities in Côte de Neige. Do you have anything in particular to say about the impact of COVID-19 on women and girls in particular?
Well, I think it's all over the country, but it's true that rates of domestic violence rise because, women are often trapped in homes with men that use violence. That's one thing. But also, just in general, people are not getting the support they need for their levels of stress. And I think the government should have intervened in terms of parent support. And for Indigenous people, we don't want that to come from child welfare. We want it to come from other sources, community organizations. But parents who've had to be their child's full-time educator and teacher and tech person, repairing computers and getting all these programs going, and really keeping children engaged and busy in this time, and where everybody's isolated and under-resourced. It's been so burdensome for parents, as Tiffany was pointing out. And I think we needed a special kind of program where they could tune in and get support and tips, even on television, for how to manage the situation, and more just how to find harmony with the people you live with, or make separate spaces or rituals to give people peace of mind. And that's been one part that's really lacking. And in many cultures, women, they go out to work for money, but they also take a large part of the cooking and cleaning, and making sure the childcare is all in place. Of course, men are helping more and more, but typically women have that double burden. And so, I think Tiffany said it all. You have to go out to work. How do you get there? Is it risky on the bus? What do you do with your children? Are we putting them in, compromised situations, even sending our kids to school when we really don't want to in our heart, but we don't have a choice? So I think, again, when you look at the scale of economics, people who are wealthier and have bigger homes, they have more choices, and other people really don't. And so women fall in that category, really kind of stuck and have to take risks, right?
I would like to add to that, Fo, because it's such an important point, and this conversation is about connecting and showing the relationship between communities and some of the similarities that our communities, vulnerable communities, suffer. And Catherine mentioned youth protection and coming in, and that is not the support that families would need. And we saw at the BCA, because we have a community access support service where we accompany families. And some of our families are followed. Most of our families that we engage with are followed by youth protection. And we were surprised to see during the pandemic, where we saw the stress levels go up at home, and there was not a lot of empathy that was exuded by the institution when going in to verify and follow on dossiers, to the point where our staff, who was working remotely, was still trying to accompany families via Zoom with social workers. And the things that were being brought up were so would be understandable considering the condition, but we didn't see that empathy come across from the institution. And I agree with you wholeheartedly, Catherine, that the government needed to consider what family dynamics would be like, and that family dynamics are different, and how can we support families? Obviously, one, in the interest of not only the children, to make sure that they're well taken care of by the parents, but that means you have to reinforce the parents to be able to do that, who are now workers, teachers, homework bearers, meals and entertainment, right? So I think that is such an interesting point, and that we found that similarity as well with our families here in the urban setting.
Yeah, can I just add one thing, and then I'll hand it back. I took up the ukulele with my son, so we started playing together, and that's brought a lot of joy. So you have to think of something new to try, right?
Well, it's all about sharing, not only sharing experience, but also sharing, the wealth of, among other things, the knowledge across cultures, across all these social and economic boundaries. So I'd like to now invite Ramon Vicente to join in the conversation, because you also from a community that is very present in the healthcare institution. You have personal connection to the healthcare institution. You also live. You serve many members of the Filipino community, live in Côte-des-Neiges, and have also experienced a lot of the things that we've talked about, not only as women, as healthcare workers, but also members of a minority group in the city. So Ramon, would you like to, first of all, tell us a bit more about yourself and your experience or your background in this situation?
Good afternoon, everyone. Thank you for having me. I was an ex-president of the Filipino-Canadian Association of Montreal, and that's the time with Marlene Birao that we have this famous fork and spoon. I was also ex-president of the Filipino Association of the West Island, the FCAWI, and an ex-vice president of the Filipino Association of Montreal and Suburbs, FAMAS. My observations of the impact of COVID among women, especially women in our community, because as you all know that most of the Filipinos are working in the hospitals, frontliners, and caregivers, babysitters. They are mostly Filipinos. and they are being impacted with this COVID. I have several stories to tell you, but the one that I'm going to say is the one that's very close to me because they are related to me as my dear friends. Wife of my friend is a nurse, and during the early pandemic, he was contacted by the COVID uh, positive. So he has to. They have to put her in a hotel for 14 days quarantine. She at that time has a 3 months old baby.
Mm.
She's breastfeeding the baby. So there's a traumatic experience there. Who will feed the baby? And the husband is there, of course, but they have to start introducing the bottle feeding. So that would be a little traumatic, or with the child and the mother. The second sad story is a friend of mine, is also a nurse from South Shore. His mother was very sick with cancer, and he has to accompany her back to the Philippines because with the COVID, he cannot take care of his mother here in Brosard. So he accompanied her mother to go back to the Philippines so that the two brothers can take care of his mom, his mother. They were from Cebu. Within days, the mother contacted COVID. My friend contacted COVID. The two brothers contacted COVID. Within a week, there's 4 dead people in that household. It was very, very disheartening, to me. Another impact for the frontliners, especially the women, the nurses, is they have to work overtime during the pandemic. And the children are staying at home, and who's taking care of them is their old parents. I have met them. I saw them in my own eyes because we have this food 4 wheels drive to give food to all the seniors in coordination area and also the West Island and the South Shore, but mostly coordinates because they're the number one COVID on that time. So we took care of the old people that's taking care of the grandchildren. And I met them, I saw them. You know?
That's why we have this conversation, because we may be different in many ways, but in many ways we are the same. We live the same situation of hardship, of depression, of also all kind of burdens. The more we talk, the more to see that we may be different in terms of race and ethnic backgrounds, but we have a common challenge, and we need to work together, at least to talk, to exchange, and see how we can develop, build bridges and develop, common actions together. So let me bring in right away Raul Warma from the Tisri Dunia Theater, because the theater group has always played a very important role in fostering, among other things, cross-cultural discussion, but also action and awareness raising about some of the very important social and economic issues in the city. So Raul, would you like to join us right away in talking about how COVID-19 has, among other things, impact your environment and the people you know about, whether they're from your community or from other groups?
So I just want to say a few words about the theater company that I represent, the Tisri Dunia Theater. This was formed almost 40 years ago, and this was among few companies that were from the very inception were intercultural in their perception. So the multiculturality and interculturality both work side by side. We saw that they are exchangeable, interchangeable. So we were also the first company where the work of the cultural minorities, indigenous people, and even the dominant cultures was presented on the same stage. The perception was that that is who we are as a country. So what our streets are is what our state should look like. And social justice has been a theme, a constant theme. Respect to the diversity has been a characteristic of the company. And just to put it in a context, in the month of March, we were presenting a play called Counter Offense, which addresses the issue of violence against women and racism. And it was a kind of an accident that story of the George Floyd had taken our imagination. So there could not have been, and this particular play was dealing a very complex issue, and that was what do you do when struggle to end violence against women comes in conflict with the struggle to end racism, because two are very burning issues and they often intersect. So that was the play. So there could not have been a better time given what George Floyd had triggered all across the world to do this production. Unfortunately, just in 2 days, the production was shut down because of the COVID. And we tried to remount it month of November. We were once again unable to do that. So that's a little bit of a background. And it is connected to what I want to say about, particularly about the COVID and how it has impacted the community. There are two particular communities that our company deals with, communities of actors, particularly the actors of diverse cultures, and general public. And by general public, I mean all Canadians. I do not mean the Eurocentric audiences, which are generally a trend in most of the conventional companies. Now, our actors were severely impacted by COVID because as it is, they are excluded in terms of getting the jobs, and COVID made that exclusion doubly painful for them. The opportunities for the actors of color are few, and they were further cut down. So when the programs began to get slashed, that we could not do any activity because actors had to come in proximity with each other in order to perform what they were playing on the stage, and the audience had to sit at least 2 feet away from each other. All it resulted into banning the whole thing, and what it meant was that the actors of color who get fewer chance were further isolated and sent into exclusion. So in a way, as much as we talk about exclusion, exclusion was being legitimized by COVID, that it is a reason why they are excluded. But no, they were excluded to start with. Now they are doubly excluded. So that was one of the thing. Now the other thing is that unlike Tiffany's organization, we do not have a particular service element to our company, but more of a engagement, more of awareness raising, and more of starting a cross-cultural discussion across the communities. That said, I think that we suffered very severely in terms of experiencing the isolation from the community who we used to get into the theaters to be able to speak to them. In Counter Offense, the play that I'm talking about, as it is in all the work that we do, the characters come from the Black community, from the Asian community, Anglophone, Francophone, the Muslims. So that's a choice we make. This is the kind of a play. So all those communities are a recipient of our work. We lost them, and they lost us. In particular, and I think that I have read the second question, so I'm just going to preempt the answer a little bit here. You see, our community, the South Asian community particularly, is stratified within itself on the basis of the socioeconomic structure. There are well-to-do and there are not so well-to-do, and there are a lot of them struggling, and you do not know where to put them, whether well-to-do or not well-to-do, or how do you define the struggle part. There are asylum seekers. There are single mothers. For the cultural factors, the single mothers have a very difficult time within the community as well as outside. Services for them are not available. So certain kind of a conversation we can have with them, a certain kind of outreach we could have had with them, that was all hampered. It was very difficult on the asylum seekers because the political climate from the part of the world that I come from is very difficult. People from Sri Lanka, from India, from Pakistan, Bangladesh, Bhutan, Sikkim, all of that area, it's a disturbed area. And there was a significant exploitation, and I do not know the names, but I know the cases, and I have talked to them. They were in a very bad situation because they had to work in order to survive. So employers were all too ready to exploit them, make them do the work, load them into trucks, crammed up, and take them away to get the work. And if they get sick, they are not announcing because they are on the asylum list to get their status identified. So there were this kind of a sort of a geopolitical problem was taking shape and forming the socio-political problem as a result of COVID that was unfolding in Quebec, particularly in Montreal area. And I think that also, in our healthcare system, you used the word some time ago, the medical equity. I say that their healthcare system should very well be related to, as Kathleen was saying, to social aspects of our community. So there has to be a social and preventive side, and culture is pretty well rooted in that. So anything which is culturally informed in terms of social preventive aspects of our well-being, our health, is not available to South Asian community and in many parts cultural communities, and in particular women, because of the inner social issues. And that has been the reason why there has been a higher increase, I believe, in South Asia, more densely populated South Asian community, the incidence of that. And I can substantiate my argument by presenting an example that recently came to knowledge from British Columbia, where more culturally informed advocacy and outreach was done, and which actually resulted in lessening of the cases of COVID, and particularly in South Asian community, because the advertising, the infomercials, they were done in a language that they understood, played by the actors who were identifiable to them, and cultural connections were made, so they were able to connect with those things, and it resulted into something good. And most importantly, stigma was removed from this equation.
I think what I hear once again is all these, the fact that you're talking about all these systemic barriers, and I think everyone here talks about, we didn't say it, but racism, it's certainly a social determinant of health. And within the, that spectrum of racism, we're talking about gender-based barriers, we're talking about socioeconomic status. We also talk about age, and I think Ramon brought out the fact also seniors, some of these communities experience special hardship. In many ways, they help with their grandchildren while parents are away to work in, for example, in healthcare institutions at great risk to them. But Raul, you also brought out another sector, which is the sector of arts and culture, where many of these artists and culture workers also experience greater difficulty because as culture workers of color, I mean, the opportunities are already limited before. So COVID-19 is just exposes the fault lines that existed before. And now it reinforces all these inequities. In some data have shown that the South Asian community in some cities experience higher rate of infection. And same thing for the Black community as well. I think in Toronto, in Montreal, we know that the disproportionate impact of COVID-19, I think, hurt many communities. And all four of you represent many of the faces of these, the barriers and of the challenge that we all have to face. So with the few minutes left, I would like to invite all four of you to talk. But according to you, if you had a magic wand, what solution would you like to see happen to help relieve and bring down these barriers to exclusion, bring down the systemic, discrimination and the systemic inequalities in our healthcare system, in our social and economic system? Maybe we can start again with Tiffany. What would you like to see in terms of change?
Well, I think the first thing is that we have to look at what kind of support we have to give an access to. First, I'm going to go with my seniors first, because I really think that my seniors are suffering in the essence that by not having access to information and being pensioners, there's definitely something there in terms of helping them to ensure that they have, especially in this stage of their life, under this pandemic, access to health and healthy foods, and being able to not further strain any health issues that they have. So I would want to see the actual system address serving our seniors. As far as families are concerned and the leaders of families who work, I think that we have to immediately look at access to employment. I think what we've exposed clearly is that a lot of our community is working in frontline jobs where they are being not given the opportunities necessary for them to social distance effectively, despite having the qualifications, despite having the experience. And I think that what we see now is that the limited choices that you have in terms of employment and employment equity creates a situation where you are working in jobs that, in a case like this, it's evident that you can be mistreated, disregarded, and also not your humanity is not taken care of. And that is a part of the systemic racism. The last thing I would say is our children who are in school and now have to deal with the challenges of the pandemic. We forget what the quality of education is probably like, and then what is going to be the intervention plan or the recovery plan to help these students so they don't fall behind and then are penalized in terms of their education and being able to go forward and try to pave a way for themselves. I'm very concerned about that. And what I would like to see is the government, one, give our teachers the necessary support and our parents the necessary support to help our children to go through this year and whatever other changes that we see necessary to the pandemic, so that they're not penalized going forward and they can catch up on their education. They can feel good about themselves in terms of performance, so that they can get back on the path of creating better opportunities for themselves, which is what most of their parents and their children, the parents and grandparents, have invested in. It's for them to be the next generation and to have a different quality of life and different opportunities. So if I could wave a magic wand, it'd be those three things.
Well, thank you very much. I'm sure, Catherine, what about you?
So if I had a magic wand, people like us would fill the Quebec Legislative Assembly.
That's a good one.
Yeah. And we would do land reparations, restore Indigenous land base, as well as implementing kind of pro-diversity socialist principles that took care of the basic needs of living and just made it a more fair and just society overall, but created opportunities for people to work together on the earth, with the earth, creating our own food and, taking care of our health and well-being in the communities, repatriating a lot of government services into the community. So the cultural communities with allies could run what we're offering our people, and they have to be well funded. So really reorganizing our resources and really re-examining the role of police and policing and how to break that up so that it's more sensible, because really we all want a society based on love and care, and I believe fairness, and that's where I would take this. In the United States, they have an organization called the NCBI, the National Coalition Building Institute, and it's basically a group that does anti-racist education in police, in schools, all across in different sectors and business. And we need a organized approach like that, especially in Quebec, but all across Canada, so that people get to see the beauty of diversity and what everyone offers, because there's too much negative propaganda that doesn't benefit us, but it benefits like the 1%. So there's my little magic wand picture.
Thank you very much. Ramon, it's your turn.
My magic one is a wake-up call to people in authority, especially those political leaders, to at least acknowledge that we are multicultural. The immigrants, especially I'm speaking with my community, we came here, they're all mostly educated and frontliners, nurses, medtechs, all of this. And we already contributed a lot to Quebec, to the province. What I would just like to ask or request, or at least hopefully, is a love and respect among another. It's two-way streets. I love your religion or language or your belief, but you also reciprocate to love mine. It's just a love and respect, tolerance, acceptance. And how to deal with this is basically education. Because those people who are being racist, they're ignorance. It's either ignorance or they're coward, But if you know that we contribute, we live together here.
What about Raul?
There are few variants to Catherine, your statement, and if I may just speak them, and I'll try to make them as fast as possible. We in the arts community have been trained for the last few years to do a land acknowledgement, and that we begin to say, thanks and Ganie Kahaka and Jojage. That is where we are. But I think the land acknowledgement is not sufficient. We have to make a commitment. It is becoming a triviality, and Indigenous history is becoming a methodology for us to begin to look good instead of doing good, instead of sharing. So I would like to also say that we are in a very good place right now, because the federal government and the government across the country have declared systemic racism and have acknowledged, at least in a partial way, systemic racism. So the situation is good. So there has to be a lot of discussion, but it is very important that who is on the table and what the mandate are of the people who are on the table. Is it binding mandate, result oriented, or it is just a conversation because we are able to click the boxes? And one of the group that particularly has to be on the table is women. Across the cultures, across from different cultures, they are common. 50% plus are women. They need to be better represented on there. And I think the last point basically is education, as Ramon was saying, that the idea is not really fight, but to find a respect. So we need to have a social education beyond university education. We need to have a social education. And so for those are a few of my components of the magic wand.
You have to put forward so many important, proposals and even the kind of solutions that are achievable. If we can work together and we can build a coalition, across culture, across classes, across languages. And I think today's the conversation is an example of how we can start talking and dialoguing and also working together, because we all share the same concerns. We all face the same dilemmas and the same barriers.
What I would like to leave on is that the dismantling of racism, which is the pre-pandemic, that is the actual epidemic, would allow for all of us to rise. They say that a tide can bring and raise many boats, but we have to make sure that everybody has a boat, and we have to make sure that this tide is something that we can all collectively gain the momentum to move into a better destiny. And I think that this can be the momentum for the change that we need.
That's right. And no matter what kind of boat we have, we all sail in the same ocean, and we sail in the same sea, and certainly hopefully we'll reach the same shore and live together on that shore. So on that note, I'd like to thank everyone for this very, very stimulating exchange. And I hope that we can have other opportunities to continue this conversation, but also to build that coalition, not only among ourselves, but with so many other communities and people who are out there willing and waiting to be part of this process for change. So thank you very much, and wish you well, and please stay safe.